Hello, I'm Phil Newbold, President and CEO of Memorial Hospital and Health System. As we look at healthcare reform going forward, we're going to have to deliver a different type of care, and we're going to need a different organization, kind of a structure, if we're going to be able to deliver that first time, every time, and what's really going to be required out there in the future. And so the model that we're using is best remembered by the acronym ACE, A-C-E. And we're trying to put together this model so that we can deliver the kind of care that I talked about before, ICE, integrated, coordinated, and evidence-based, in such a way that will be very, very effective in the future. ACE stands for A, accountable. We have to be accountable for the care that we deliver, and we have to have an organization that's accountable, meaning it can take all kinds of different reimbursement schemes and methodologies and be at risk for a number of these and be able to take that at-risk payment, whether it's bundled, capitated, global, lots of different names, lots of different experiments that we see going forward. We're going to be able to take that and we'll be accountable for it, that we can deliver it and still do well as an organization and all the providers also. So accountable means that we have to have a new type of model. The new model will have both physicians as well as hospitals and urgent care centers, rehab, all kinds of home care, lots of different organizations in it. It won't necessarily all be owned by one organization, but it will be accountable across the entire progression of care. And so accountability is a big deal, and it means we're going to need a new organization. We have one. It's called MMA and Memorial, which is CHA, or Community Health Alliance, as many of we know. But that's going to be the kind of organization that will change some so that it can take some of these new reimbursement methodologies and be accountable to the insurance companies, to the government, to the patients, that we can deliver the kind of care and still be successful economically. So the first A is accountability and being accountable. The C means it's got to be very comprehensive. We have to be wherever people seek sites of care. Wherever people show up. It could be urgent care, it could be in their home with home health care, it could be after acute care, it could be in a hospital, it could be a physician's office. It's got to be all kinds of different places. So we have to have a system that is comprehensive, and as we've always said, it has to be coordinated. The electronic medical record is going to help us with that, so that we have to then have everybody in the community working together in a very comprehensive way. We're well on our way with MIN, Michiana Health Information Network, to help us with that so that we have data that moves around easily between providers in a lot of different sites of care. But it's going to be a much, much more comprehensive type of model that we work within, and that's going to be good because wherever the patients end up, we'll be there with electronic medical record, with the kinds of providers that will give them great care. So the A stands for accountable, the C stands for comprehensive, and the E means we have to be very efficient. Efficient means we've got to lower the costs of care and not reverse ourselves and go back 20, 25 years ago kind of pricing or anything like that. What we're trying to do is lower the cost of care and bend this cost curve that keeps going ever upward and just bend it down, say, 2 percentage points. That's really about as aggressive as we want to be and still be able to take care of an aging population, take care of new technology that springs up every day that's going to help us, and be able to take care of more and more people, this 53, 54 million uninsured Americans that now will be within the system. So being efficient means better ways of caring for people, lowering the costs, getting them to the least expensive and still most effective site of care, and then making sure that we don't duplicate, that we don't have readmissions that could be avoided, that we keep people healthy so they don't need physicians and hospitals and emergency rooms as much as they have had in the past. And so that gets us back into the community, It gets us into every provider's practice, and it gets us into looking at ways of driving out waste, inefficiency, costs that could be avoided, and delivering the best kind of care each and every time. And so E stands for being efficient. So there we have it. We have a model that's accountable, it's very comprehensive, it's very efficient, and that's what all of us are going to have to work on to put together. So as you watch Memorial over the next 3, 4, 5 years, and you wonder why we're doing this or not doing this and so on, it may be because we're trying to get ready for healthcare reform. And in that means we have to have some new organizations, we have to do a different style of care, and we have to be able to put some things together differently than we have had in the past. The fee-for-service world is unsustainable. It leads to just doing more for everyone. And what we really need is to move away from a system that's based on more volume and one that's based on more value. Memorial will be at the forefront working on that. We have people working at every aspect of these integrated new systems for the future. We're going to be very successful. And whatever comes out of Washington, whatever comes out of the insurance companies, whatever comes out of the state capitol, Memorial will be ready for it, and we will continue to develop the best type of care with the most incredible kinds of wow experiences, and doing it in a very cost-effective way. That's a system of care, that's a good model and a good recipe for the future.